A surgeon who contracted Ebola while working in Sierra Leone died Monday at a Nebraska hospital. This is the second known death from the virus on U.S. soil. Dr. Martin Salia, whose family lives in Maryland, was flown from his native Sierra Leone on Saturday. Health officials rushed him to the Nebraska Medical Center's specialized biocontainment unit. He arrived in critical condition. The hospital's director of critical care describes Dr. Salia's condition.
He had no kidney function. He was working extremely hard to breathe, and he was unresponsive. Within the first few hours of his arrival, we started running continuous dialysis, and within the first 12 hours, he had progressed to complete respiratory failure, requiring intubation and mechanical ventilation. Shortly thereafter, he developed severely low blood pressure and required multiple agents at very high doses to maintain even a marginal blood pressure. In this setting and in the setting of multiple treatments specific for Ebola virus disease, and despite the amazing care of our nurses and respiratory therapists, he progressed to the point of cardiac arrest.
Dr. Amar Safdar is an infectious disease specialist at New York University Medical School, and he joins us here in our New York studios. Good to see you, Dr. Safdar.
See you too. Thank you.
You know, it's always heartbreaking to hear of a fatality, especially a healthcare worker who's trying to help with this outbreak. Can you tell me what is the difference? Why have all the other healthcare workers that have come to the U.S. that have been treated survived, and Dr. Salia not?
My heart goes out to his family. Mm-hmm. He was really a brave man and a good cause, needless to say. So you asked a very good question. So this really is true for most infections, that if you catch the infection early enough, and if you start treatment promptly, the outcome is far better. And well, the other situation is if the intervention is made too late in the course of the disease. Mm-hmm. As you hear from what we know now, that the condition was far advanced. He was very sick and seems like he had multi-organ failure. Mm-hmm. So he needed renal replacement therapy, as we call it. So he was in kidney failure. He wasn't breathing, so they had to intubate him. It was initially called a hemorrhagic fever, but then WHO revised it, and it was called Ebola virus disease, as opposed to earlier on, Ebola hemorrhagic fever. And the reason was that more than half of the patients do not present with hemorrhage. Mm-hmm. So what the presentation really is dehydration, vomiting, and excessive diarrhea. So if you start catching up too late in the course of disease, it becomes very difficult if you haven't been keeping up with hydrating patients, mm-hmm. keeping up with the electrolytes, mineral replacement, and so on and so forth.
Yeah, so that he just got here a little too late. He was already in critical condition when he arrived.
That's what it sounds like.
It's my understanding there have been at least 20 cases contracted outside of Africa contracting Ebola. Has the spread been contained or not? Well,
compared to well over 10,000 infected patients, as you know, over 5,000 fatalities. The focus of infection essentially is the 3 countries in West Africa, and there is some spillover now in Mali. So you must have heard that Mali has been added to the list where folks coming to US will be screened at the 5 entry airports. People, for example, Nigeria, have done a fantastic job. So there was, as you know, several months ago, a person who was acutely ill with Ebola virus disease, flew in from Liberia, and there were some secondary cases, but they very nicely quarantined and confined the infection. Mm-hmm. In US, we have done, you can see, a very nice job. We mean CDC, I don't want to take credit for them. But I really hats off, because in Dallas, there had been several secondary exposures, some low risk and other high risk exposures. And then people were identified and they were then put under observation. And we know that there had been no known secondary cases except for the two healthcare workers, the nurses,
Right.
who took care of the patient
Right.
hands-on, especially towards the end of the disease.
Yeah, that was Amber Vinson and Nina Pham. So let me ask you, tell me a little bit about where scientists are with vaccination and treatment of Ebola.
Yep. So the treatment is really multifaceted. There are several things in the pipeline. It's not just antiviral drugs, but also a way to interfere with virus, infecting other cells, stopping the virus from leaving the cell and entering other cells. The two vaccines that are being studied right now, I just saw before, because I knew you were going to ask me this question. There had been 200 individuals that have been enrolled in the vaccine trial in US, in UK, Switzerland, and in, I believe, an African country. I don't remember which country that is.
Okay.
And this is a phase 1 trial. So this is really looking at safety of the vaccine and also looking at the right dose of the vaccine.
Yeah, we're hoping the scientists can move fast. This is very important. Dr. Amar Safdar, thank you so much.
Thank you for having me.
Good to see you.